A dawn to dusk or dusk to dawn curfew that was imposed yesterday by President Uhuru Kenyatta. What imposed a night curfew as opposed to a day one, having that the ministry had already shut down major night activities like clubbing. And number two, there are private clinics already that have begun offering tests for they are calling drive-through test for COVID-19. Has the ministry approved the same? And the last is concerning the patient that was released yesterday as to have recovered. Can she transmit, or can she be reinfected again after she gets out there? And what are the medicine that has been used to cure her and have her released? Thank you.
Please ask one question.
Asante. Jina langu ni Waweru Nyambura kutoka Inoro TV. Ningependa kujua serikali imeridhika vipi na mpango wa self quarantine. Ukiangalia kwa kufikia sasa kuna watu ambao wamekuwa wakikiuka sheria na masharti ya self quarantine, na kuna mpango ya kutupilia na anyone who is under that program aletwe kwa serikali ili monitoring ikuwe ikifanywa na serikali.
Maybe in the last few minutes, we did hear information from another account where the governor did confirm one case. Maybe I don't know whether you are aware of it and whether the county governors are in a position to declare or maybe to confirm coronavirus cases.
Right, I think we'll take that set of questions. And I'll start with the question on the curfew, and then the Director General will come in and answer the question with the patient that was released. So concerning the curfew, indeed, the President put in place a curfew, and this curfew is a measure of strengthening the messages that we've been relaying to the public. Social distancing, ensuring that that physical distancing is our first guard as a weapon. Why this was needed and why this was needed to be emphasized is because we've noticed, despite putting in place instructions, Kenyans have not been adhering to this. We have reports coming in that people are still congregating in clubs, in restaurants. We have reports coming in that people are holding house parties. That is still not social distancing. So now we've put in place this instruction and this directive that will be able to actually help us all implement the physical and social distancing. That is the weapon against corona. The DG can speak to the patient that was released.
Thank you, Madam CS. The patient who was released is case number 2, who had been admitted at Mbagathi Isolation Unit, and we follow the WHO approved protocols which require that we do serial tests until we have 2 consecutive negative tests, and therefore the patient met that criteria after having 2 negative tests. Potentially, of course, reinfection is possible if you come into contact with another COVID case. So even if you are released from treatment or from quarantine, you are still required to follow the infection prevention control measures just like any other person. And let me also take this opportunity probably also to address the issue of Kakamega. Yes, we have had reports that the governor of Kakamega indicated that they have reported a positive case. The case that was reported by the governor is actually a case that is currently admitted at Mbagathi Isolation Center. And the fact that this gentleman comes from Kakamega County, I think that is why Kakamega decided to report. But we want to appeal to the county governments that we have one central reporting system so that we are consistent throughout our reporting in line with WHO requirements. Thank you.
Thank you, DG. There's one more question that was raised concerning the testing that's happening in the private laboratories. I'm informed by the team that that laboratory is accredited for testing. However, we're in discussions with that team as to how that can be conducted. So we'll be able to share with you further on the labs that will continue to provide this in terms of private testing. Right, so there was a question on self-quarantine. Again, we are reviewing this. I think you noticed that we instituted mandatory quarantine for all incoming passengers from international flights. What we are going to need to observe is as the situation progresses and becomes more dire, we will require Kenyans to actually observe self-quarantine. We are now in the process of developing and strengthening how the oversight of self-quarantine will look like and how we can adopt a multi-agency approach in ensuring that Kenyans who are put under self-quarantine are actually adhering to it. So I think... Right. So right now, the patients that we have, as earlier communicated by the CS,
we apologize.